Hey class, I wanted to give you a little bit more detail on the pathogenesis of pulmonary vasculitis. I added a little bit more information to Dr. Pasquale's lecture from last week on pulmonary vascular diseases, so these slides are now updated if you want to go get them yourself. But to quickly run through the additions and some important associations that I think you'll need to know. If you look at this slide that was part of the lecture, you'll see that there are several ANCA-associated vasculitides. They're associated with antibodies against neutrophilic cytoplasm. Some intracellular structure is targeted by an antibody, and this inflammation then results in vasculitis. There's commonly pulmonary and renal involvement in several of these conditions. Here are the several different types of ANCAs that Dr. Pasquale mentioned. And on the next slide, you see several different types of vasculitides and the common abbreviations. This is another situation where you have different names for the same disease, but you'll see the most commonly used name it varies actually depending on your source. Granulomatous with polyangiitis, which was formerly known as Wegener's granulomatosis, is an important one to remember. Microscopic polyangiitis is also one to be aware of. Sjögren-Strauss syndrome, like he mentioned in class, is one to know. This is also referred to as eosinophilic granulomatosis with polyangiitis, so that helps you distinguish this from the first condition. There is an idiopathic pauci-immune pulmonary capillaritis. This is mostly isolated to the lung and doesn't have many associated antibodies. You may just have an awareness of that condition. And then Goodpasture syndrome and Behçet syndrome also can cause pulmonary vasculitis. On the next slide, which we've added, we want to highlight for you some specific associations that you'll probably want to commit to memory as you go forward into the testing. First, granulomatosis with polyangiitis is associated with C-ANCA. This is an antibody to a proteinase 3, and this is the most common antibody that you will find in this condition. Microscopic polyangiitis is most often associated with the P-ANCA form of this antibody, which is an anti-myeloperoxidase antibody. Next is Sjögren-Strauss syndrome, and the thing to remember about Sjögren-Strauss syndrome is it's very commonly associated with eosinophilia. This is really the hallmark of this condition. When antibodies are also present, you'll tend to find P-ANCA antibodies, that myeloperoxidase antibody. And these patients with Sjögren-Strauss often behave as if they have a form of asthma. They have wheezing, they may take asthma medications, and this can be a reason that this diagnosis is delayed. Of course, I said that idiopathic pauci-immune pulmonary capillaritis does not have any characteristic antibodies. Goodpasture syndrome is an important one to know because it has very specific findings. Goodpasture syndrome is a very good example of a pulmonary renal condition, and the antibodies here are actually antibodies to the basement membrane of structures, predominantly the antiglomerular basement membrane. And when these are evaluated on biopsy, fluorescent staining is performed, and this shows a very linear immunofluorescence. I have a picture of this on the next slide. So this is a biopsy specimen actually from a kidney, but what you can see clearly is this is a fluorescent image, and the antibody that's been used is staining the basement membrane all throughout. It's very linear. Okay, it's not patchy, these are not dots of staining, it's just outlining the entire basement membrane. So if you see a picture like this or hear a description of a biopsy that's linear immunofluorescence of the basement membrane, you should really think about anti-GBM antibody disease and Goodpasture syndrome. Otherwise, the treatment of pulmonary vasculitis was also mentioned in your talk. Be aware of some of these options, but I don't think you'll need to know the details of how and when each of these diseases is treated at this stage of the game. You'll worry about that as you get later into clinical and into further training. So I hope this is helpful. Again, these slides have been updated on the LCMS Plus event if you want to download the new slides for yourself. But just wanted to be sure you knew some specific details about these antibodies, which will be important for you to know for testing probably going forward. All right, best of luck to you.